Hey friends, welcome back to the channel. Dr. Nikhil here, and in this video, I'll take you through my highlighting system and how it helped me have more clarity about the content I read, make better connections between concepts, revise more quickly, and remember more. And although highlighting is not regarded as the most efficient study technique according to the research, but I observed that my highlighting system also adds a little bit of active recall to the mix, and we know that active recall is one of the most efficient study techniques out there. I'll explain how all of it works in this video. Now, I didn't have a proper highlighting system from the beginning itself. When I was in MBBS, I used to use the yellow fluorescent highlighter to highlight my stuff, and that was about it. I used to highlight what all is important, and there was no system to it. I used to just highlight to emphasize what the key points in any topic are, and of course to make myself feel better about having read that stuff. But over time, I began experimenting a little bit with highlighting to see how it can make studying more efficient. I started adding more highlighter colors, well, initially just to make it look more fancy, but eventually I came up with a highlighting system that worked best for me. So my highlighting system is pretty basic. It consists of just three colors, that is red, yellow and green. So the red highlighter is what I use for the important or the key stuff, the previously asked questions and the volatile stuff. Secondly, I use the yellow highlighter just regularly as I used to before for just keywords or just general important info. And the green highlighter I use for the basic facts or topics which are based on some basic concept. And that's pretty much it. So now let's hop on to some examples to show you how this highlighting system helped me and how it also added active recall to the mix. So here I have copied down some notes about prenatal genetic diagnostic tests in pregnancy into my iPad. Now these are tests which we do on pregnant women to find out if there are any anomalies in the baby or any other condition that the baby might be suffering from. So the first point here, as you can see, is amniocentesis, and the first point was that it is contraindicated in the first trimester, that is up to 12 weeks of gestation. Now I have highlighted this particular fact in green because this is based on a basic fact. So the basic fact here is that in the first trimester, the amniotic fluid volume is way too low. That is, it is up to 60 ml. So this is too low of an amniotic fluid volume for you to also remove more amniotic fluid. If you do that, then it increases the risk of miscarriages and other complications in the first trimester. And that is why amniocentesis is not done in the first trimester. So this point in itself is very small, but it was based on a basic concept, so I highlighted it green. And then skip right to the next point here, that is fetal fibroblasts are sent for genetic evaluation. Now before that, I had the points that the fluid is collected, it is centrifuged, and then the fetal fibroblasts are sent for genetic evaluation. Now all of this is just basic stuff, fluid collected, centrifuged, so you don't need to highlight all of that. The important thing here is fetal fibroblasts. And well, it was just a basic thing, it was not super important, or it was not something that is based on basics according to me, and so I highlighted it yellow. Coming on to the fetal lung maturity test, so basically these are some tests done to detect whether the fetal lung is mature or not. The first of them is the LS ratio, that is the lecithin sphingomyelin ratio, which should be more than 2, which indicates mature lungs. Now this was just a general fact, I highlighted it yellow. But the second point, that is the PG test, phosphatidylglycerol test, I highlighted this red because this was the best test here. Then third comes the lamellar body count test, which is the most commonly done test, and I highlighted it yellow. Actually, I think this should be highlighted red because it is the most commonly done. Let me just change that thing then. I'll highlight it red. Let us get to another example here. Let's move out of obstetrics and go into medicine, cardiology, ischemic heart disease. Now here on this page are the symptoms of ischemic heart disease. The most common one is chest pain, as you know, and I have written the characteristics of this. And one of them is the radiation to left arm and forearm due to stimulation of C8 and T1 nerves. Now this is actually one of the basic concepts in ischemic heart disease, that the pain radiates to the left arm and the forearm. That is actually one of the characteristic ways in which you identify that it might be the pain of an ischemic heart disease and that the patient might be having a heart attack. Now the basic reason for this is the stimulation of the C8 and T1 root nerves situated close there. Since this fact is based on a basic concept, I highlighted it green. Moving further, if there is autonomic dysfunction, then there is painless angina. So actually in elderly people or in people with diabetes, an interesting phenomenon may happen whereby they may get a heart attack or an ischemic heart disease and they may not even feel the pain of it. That is because of the autonomic dysfunction that occurs in these. And so the classical pain that is associated with ischemic heart disease, that is called angina, that is not present in these people, and so it is referred to as painless angina. In such cases, you look for angina equivalent symptoms. That is, if the pain is not present, you look for some other symptoms which sort of act as a proxy to the pain. And these include unexplained breathlessness, unexplained sweating, and unexplained sense of impending doom. Now this angina equivalent symptom is something different. We know of ischemic heart disease pain as the characteristic retrosternal pain, which is dull aching and which makes the person hold his fist there, which is also called as the Levine sign. But in these special cases, angina might be absent, and so this is something that I might forget, and so I had highlighted it as red. Now among the other points of angina, that is the retrosternal site and the dull and constricting nature, I didn't highlight those points because by the time I was reading this, those points were pretty obvious to me. And these were something which I was very less likely to forget, and so I didn't highlight them. I had also mentioned previously that this highlighting system also kind of helps in active recall. Now how is that? For example, let's get back to the amniocentesis point. Now when I see that contraindicated in first trimester point is highlighted green, It will force my brain to think about why is this highlighted as green? Why did I think of it as a basic concept? This will force my brain to think about the reason of this, and then when I'll think about the reason, that is the first trimester has lesser amniotic fluid, it will get more strongly reinforced in my memory. And secondly, if consecutive lines are highlighted, then I can sort of see the next line highlighted through my peripheral vision. Say for example, here I'm reading and I get to this point of LS ratio being more than 2, being indicating mature lungs. Now while I'm reading this point, my peripheral vision can see that the point below it is highlighted in red. So I'll automatically begin thinking of what the next point might be that I've highlighted it red and what it might be, because it was an important point. And this way I'm forced to actively recall that next concept. And this is the way I think that this highlighting system of mine adds active recall to the mix too, which is one of the most efficient study techniques out there. Do you follow any specific highlighting system or a color coding system? Put yours down in the comment section below. So that was all about this video about my highlighting system. I hope it helped you out. If it did, then please consider liking and subscribing to the channel. And I'll see you then in the next one. Bye bye.